Mexico. My presentation today is based on my research on this office called the Office of National Drug Control Policy. This is the lead federal agency in the United States that organizes and orchestrates our national drug control policy. So you may know them as the Drug Czar's office. It's a term that's been used, applied to them in the past. This office every year is charged by Congress to state the goals of national drug control policy, to state the goals of what we in the United States have long called the drug war. They're also required to state the budget, to determine which agencies get how much money, and to communicate with the American people how it's going, how drug policy is effective or not. We have analyzed, my co-author and I, Renee Sherlin from Appalachian State, we have analyzed the 2000 through the 2007 national drug control strategies. And I've done subsequent analysis of the 2008, 2009, and 2010 strategies. So this document, the National Drug Control Strategy, is the primary way that the United States government communicates with the American people and with Congress about how the drug war is going. Well, you might guess based on the title of the book, Lies, Damn Lies, and Drug War Statistics, that my argument is that the United States government manipulates data to suggest that national drug control policy is going well, when in fact it's not going well at all. So my presentation is about two major things. The first is whether we are meeting our stated goals as a country in terms of drug policy. And the second is how does ONDCP, I'll call it the office for simplicity, the Office of National Drug Control Policy, what does it say about these goals? How does it utilize data? These are historically the goals of national drug control policy, the first being the most important, to reduce drug use in the United States. We also want to reduce supply of drugs, help people that have drug abuse problems through treatment. And these final two were actually dropped by the Bush administration, by ONDCP under the Bush administration, reducing crime and reducing health and social costs. However, the Obama administration has taken the final one, number 5, and reinitiated it or reprioritized it, basically saying that the two goals now are to reduce drug use and to reduce consequences of drug use, including death. So for example, here's a slide from 2010, from the most recent National Drug Control Strategy. They're saying, if you look at this red line here, there's a lot more people dying from drugs. In fact, it's the only major cause of death on this slide that's increasing. What's interesting is ONDCP is still silent about what this means. This, to me, is the clearest indicator of failure of policy, that over time, more Americans are dying from drugs. Even as we spend more money, we sacrifice more lives, we break up more families, as well as many other things, spend more money. If you look at the death rate per user, which is very interesting, drugs are actually 5 times more likely to kill you now than they were in 1979 for the average user. This is because illegal drugs are becoming more dangerous and people are switching to more dangerous drugs. This is one of the ultimate results of drug prohibition. So here's my major conclusions, and then I'll show you some examples of the research. The first conclusion of this research is that the actual data available from the Office of National Drug Control Policy show that none of their stated goals are being met. Drug use is not down since the office was founded. Young people have not stopped using drugs. They've simply switched, and often to more dangerous drugs. Drugs are still widely available to Americans. They're no less available. And the vast majority of people who need drug treatment simply don't get it in the United States. The second conclusion is that the ONDCP denies this, basically. And they do this several ways, so I'll show you examples of this. They focus on short-term drug use trends to claim success while ignoring long-term trends. They overemphasize the data source called Monitoring the Future, which is a measure of young people's drug use, and they focus on certain drugs while ignoring others. They sell policies that evidence suggests are failing, such as student drug testing, in spite of the actual published evidence of their ineffectiveness. They selectively present data and actually manipulate data. I'll show you one clear example of that today to make their case. They fail to provide a real comprehensive assessment on market disruption efforts like price, availability, and purity of illegal drugs. And they fail to do any kind of cost-benefits analysis. So they always talk about the benefits of drug policy while ignoring the costs in order to see which weighs more. So here are some examples of these findings. The first and, of course, most important question is drug use down? This is an example of the kind of presentation that the office makes. So you see, look here, right? They're saying, look here, drug use is down. This is drug use by 8th, 10th, and 12th graders from 1991 on. So we're winning, right? Except that drug use is actually higher now than it was when the office was founded. So as a taxpayer and as a citizen of the United States, I want to know, why is drug use higher now than it was before we founded an office to actually fight the drug war? It's a fair question. Here's another example of the type of presentation. Notice the short-term focus. This table shows you that drug use is down across the board, apparently. All of these negative numbers means that drug use is down by that percentage. The stars mean it's statistically significant, so that means this is based on a sample of 8th, 10th, and 12th graders. Okay, so this is not random error. What's interesting about this slide is you look, every single type of drug use is down except heroin, apparently. But so is alcohol and tobacco use, which is illegal for young people, but we don't have a war on it. So the question is, why is alcohol and tobacco down, even though we're not fighting a war? Maybe that's the main reason why these other forms of drug use are down as well. But you notice this, if you can read, I'm not sure how well all of you read English, but in terms of, you probably recognize the drug names, right? But you don't see narcotics. You don't see data on sedatives. You don't see data on tranquilizers. Well, why is that? You might suspect, and you would be correct, that that's because these drugs are actually increasing in terms of use. So ONDCP simply ignores the data. Now, in fairness to President Obama and the new drug czar, Gil Kerlikowske, there is a renewed emphasis on prescription drug abuse, finally. So this is the 2010 strategy. The box says that after marijuana, 7 of the most prevalent types of drug use are prescription drugs. So here's your evidence that young people are switching to drugs that are easier to find. Unfortunately, these drugs are more addictive and they're more deadly than the drugs that they used to use, the ones we're fighting the war on. Here's an example from the 2010 strategy of ONDCP's focus. To the credit of the Office of National Drug Control Policy, I'm very pleased that finally ONDCP has gone back to 1975 to show us what's happening long term. But ONDCP, whoops, sorry about that. It's a sensitive computer, forgive me. The red line indicates when the Office of National Drug Control Policy was founded, November of 1988. As you can see, drug use is not down among 8th, 10th, and 12th graders from that time, which is their stated goal. Now, they've made it clear, not only do they want to reduce drug use, they want to reduce it consistently. So the trend line should look like this. But that's not what it looks like. Now, another way that, and this is what I would like to see the office do every year, is a systematic evaluation of drug policy, drug by drug, population by population. So I'm going to show you real quickly what's really happening with drug use in terms of 12th graders, which is the most common use of age of use.